Approximately 17.1 million Americans are plagued by major depressive disorder, an integrated premier group specialty. Another of our Live Well partners here to talk about the therapy to help MDD. And good morning, Jeff. How are you?
Good. How are you, Brad?
So, listen, I'll tell you, Scott, and Mr. Jeffries, I just called him, and he's like, so, Scott, first of all, glad you're part of our Live Well program.
Thanks for having us.
Also, I'm glad of what you're doing to help people, especially with depression right now. And we're seeing more and more as we're getting back to school.
Yep.
People getting back into work. And then this next kind of virus that's coming in is starting to really affect people. But you say there's a treatment that has been working and helping.
Yeah, so we introduced recently TMS Therapy, which is Transcranial Magnetic Stimulation. And we are treating it specifically for patients that have major depressive disorder that seems to be drug resistant. The transformation that we've seen in our initial class of patients it's really an amazing service for folks.
All right, so how does this work? How does this therapy work?
Okay, so it is essentially taking electrical energy out of the wall, transforming it into magnetic energy, and it's literally pulsing it through your skull and tickling brain cells.
Yeah, tickling brain cells.
I think is a good way of describing it.
And that's very important. I think what they say through depression, that parts of your brain start to deactivate a little bit and need to be kind of kick-started.
Yeah, and this seems to kickstart brain cells, getting more blood, oxygen back to these cells, and bringing people back down from a depressed state to a more baseline, happy place for them.
All right, if someone's sitting at home right now and maybe they're trying to understand what brings on the depression, what can bring on some of this disorder right now?
Lots of things. As simple as leaving your house and driving to your office can help build up to things that make you depressed. And over time, with major depressive disorder, it's a whole series of things in life that you've just sort of maybe lost some control over. And the result is you're in an episode of depression that maybe medication isn't really helping out anymore.
Yeah, and I think we got to stop using the word in a funk. I think that is a big word that you guys kind of hear when you talk with the patients. Like, well, I'm just in a funk, or my child's just in a funk. We can't ignore that. There's probably something going on more, right?
Yeah, I think using the term in a funk is a safe word, or what we consider a safe word, instead of saying, I've got depression, I'm depressed.
Yeah.
That takes a little bit more energy to say, and kind of an admission that, all right, you need some help.
Yeah, and I think talking with your team, that is where you guys start with people. You're like, let's address what's going on here.
Yep.
It's not so much about being in a funk, it's about being depressed. And once you said, hard part saying it, but once your team gets someone to say that, then you're able to work with them.
Yeah, as we say, the most important thing for these patients is that making that initial call to us. That takes a lot of energy to do. So we want to make sure that when they come in, they are welcome, they're in a welcome environment, we are really nice to them and kind, and we listen to what's going on in their life. Because TMS might not be the solution for them.
Right, I was going to ask about that, and that's one thing that's important, that you sit down and talk with them, because you're not just going to automatically just assign this to them for their therapy.
Exactly right. In fact, some patients may not qualify for this therapy because they may not have a history of medication failure. And that's really what we need, in addition to talking with our psychiatrists to determine if you're TMS qualified.
Yeah, I'll tell you, your team's amazing over there, especially right now, as we said. Not just for our adults, but for our kids too, who are going through things. And you're ready to help them, because we know
absolutely
mental state right now for a lot of people has been bumpy with things happening over in other countries, and with the virus going on. So it's very important. How can people find out more about, of course, the therapy and what you guys are doing?
Couple options. You can give us a call, 480-900-CARE. I think it's 2278 is what the CARE spells out. And then our website, ipgspecialty.com. Give us a call, check out our website. Our website has some information on it, but give us a call. We'd love to have you come in and meet with one of our team members.
So, Scott, thanks for coming in.
Thanks,
it's always
Brad.
nice talking to you and having your team on board for our Live Well program.
Appreciate it. Thank you.